Talk about some of the common conditions of our upper respiratory system. We have rhinitis, which is runny nose, congestion, some sneezing, cough, postnasal drip, sore throat, and the common cold. So first we'll look at some intranasal steroids, and the one we're going to use for class is fluticasone or Flonase. That's going to reduce the histamine and edema. So if we have someone with allergic rhinitis, non-allergic rhinitis, nasal polyp, or chronic sinusitis, this would be what we would want them to take. Now, they may not like the smell, they may not like the taste that it gives them. It does, because it is an antihistamine, it's going to dry out their nasal passages, and it can also give them nosebleeds. We don't want people that have a sensitivity to steroids or people that are pregnant to take these. The next one is the intranasal decongestant. Now remember, decongestant is going to shrink those passageways so that our secretions can flow out again. Oxymetazoline or Afrin is the one that we use for this. We don't want to use it more than 3 days in a row. If we do, we could have what's called congestion rebound, where we get our congestion cleared up, we stop taking it, and then it comes right back again. Now, sometimes they do report burning or stinging in their nose. And the reason we like to use intradermals over a PO tablet is because it doesn't have as many side effects. Now, interesting fact, if you have someone that has a lot of frequent nosebleeds, Afrin is a good medication to keep on hand. That is good at stopping nosebleeds. All right, so antihistamines is next, and it tries to block most of the histamine. Now, there's other different effects that it can have, antipyretic and antiemetic effects that are nice that we can use for that, specifically diphenhydramine or Benadryl. So the first generation, remember, all first generation meds are going to have more side effects. We get better. The higher generation we go, we get better at controlling some of the side effects. So you've probably heard of a lot of these, and I know we've talked about diphenhydramine a lot in this class, hydroxyzine, Domitane. Second generation, and again, these usually don't make you sick, loratadine, fexofenadine, sertrazine. So when would we use these? Again, allergies, if we're having a runny nose, our eyes are watery, if we're having itchy skin, we'll give things like diphenhydramine specifically if we're giving someone a medication or a blood component and they have an allergic reaction to it. Colds, we can use it to treat the symptoms of colds. We do use these to help with nausea and vomiting as well. I think we've mentioned that before, and also sedation as well. So you might have someone that they might take a medication, say for example, morphine can cause you to have some itchiness. So you might have a provider that says, I know that you're going to get itchiness, you're more prone to the itchiness with taking morphine. So on top of your morphine, I'm also going to give you an antihistamine as well. Side effects of the antihistamines here are drowsiness. Again, it's drying everything up. So dry nose, dry mouth, dry throat. It also will thicken those bronchial secretions, which is not really what we want. So if you're taking antihistamines, we want to encourage you to drink a lot of fluids to kind of thin out some of those secretions and help with the dry nose, mouth, throat. We can develop hyperthermia, confusion, delirium, seizures. It's pretty rare for those to happen. Decongestants, phenylephrine is what we're talking about here, Sudafed. It causes vasoconstriction in the nasal membrane, so that's going to help to decrease some of that swelling so that those fluids can get out of our nasal passages. And again, just if you have somebody who's real congested, this is the medication for them. Some side effects: they may feel nasal burning, stinging, and dryness. It can cause some tachycardia and other cardiac arrhythmias. So if you see, sometimes we'll see people that will try to use a lot of Sudafed to kind of keep themselves awake. It will cause tachycardia on them. We don't want them doing that. It can cause some blurred vision and nausea and vomiting. Now, if you're taking an MAOI, which is an antidepressant, we don't want you taking any of these. Also, if you have thyroid disease, diabetes, hypertension, cardiovascular disease, coronary artery disease, peripheral vascular disease, prostatic hypertrophy, and glaucoma, we want to be real careful with you taking these. Antitussives, and we have an opioid and a non-opioid. These are cough medicines. Codeine is our opioid. You'll see codeine with your cough syrup, or you'll see dextromethorphan. And what it does is it stops that cough center in the medulla of your brain. This is for a non-productive cough. So we'll get to the medication we'll take in a minute for a productive cough, but this is just for that dry cough. They might have drowsiness, dizziness, headaches, constipation, and some nausea and vomiting. Now, if we have someone with a persistent cough, we need to find out what's going on, or if they're having excessive secretions, this is not a good choice for them. If they are using the antitussive with codeine in it, we want to make sure they're not pregnant, they're not actively having an asthma attack, respiratory disorders, a whole list of things there for you to look at. Now, if you have a wet cough and you're coughing stuff up, this is what we want you to use: guaifenesin. It's an expectorant. It's going to increase the production of those secretions. It's going to decrease that thickness of the mucus so you can cough that stuff up. Again, someone we don't really want taking guaifenesin is somebody who has asthma. We're going to use cautiously in pregnancy and labor. Again, that persistent cough, we need to find out why it's happening. We just can't be treating that symptom. If you have respiratory insufficiency, again, asthma, or if you're elderly. Mucolytics. This is acetylcysteine. You know the little mucus guy on TV for Mucinex. These mucolytics are going to reduce that thickness of our secretions by acting on the mucus. So if we have bronchopulmonary disease, if we have someone getting trach care and they have really thick secretions, we can give this. Cystic fibrosis may need it to thin out some of their secretions. Post-traumatic chest conditions, atelectasis, and this actually is the antidote for those acetaminophen overdose. All right, let's look at the lower respiratory tract now. Let's talk about asthma. Asthma is a persistent respiratory illness with inflammation and constriction of those airways in the bronchial tree. So that air is not getting down there and getting exchanged like it needs to. So you'll hear wheezing. They'll have shortness of breath. They'll probably get really a tight feeling in their chest, and they will be coughing. Now, usually it's an allergen that can trigger that event. So they may have seasonal allergies. They're out with whatever they're allergic to, and it triggers them to go into an asthma attack. So the airways are going to narrow up. They're going to bronchospasm. They're going to get inflamed, have a lot of mucus, a lot of swelling. Those alveolar ducts at the bottom, the alveoli, they're open still, but we can't get that air there where it needs to go. Poorly managed asthma can lead to a lot of respiratory infections and lung damage all the way to respiratory failure. Status asthmaticus, this is a medical emergency. It can last minutes to hours. So you might have someone that's having an asthma attack We give them their rescue inhaler, we give them everything we have, and it doesn't work. They're still having that asthma attack. They need to get to the ER immediately. This can kill them. COPD, chronic obstructive pulmonary disease. This is chronic and progressive. They have an airflow limitation that traps air in their lungs, so they can't fully exhale. So people with chronic bronchitis, emphysema, smokers have a lot of this. Dyspnea, chronic cough, a lot of sputum. They will have unexpected flare-ups or exacerbations, and that can lead to them becoming ill or being hospitalized. Many of these are going to need supplemental oxygen. We have to be really careful about how much oxygen that we give them. They're very anxious people because it's hard for them to breathe, and if we can't breathe, we get pretty anxious. Risk factors are a history of asthma. If you're around a lot of air pollution, if you had a lot of respiratory infections as a child, and as I mentioned earlier, smoking. They do get exacerbations. They can go into respiratory failure. They can develop pulmonary hypertension. They do get a lot of bacterial infections. They're more at risk for it, so they'll have pneumonia a lot of times. Now, emphysema, this is the air spaces at the bottom are enlarged due to the destruction of the alveoli walls. So we're not getting the gas exchange that we need to. Again, smoking is a big risk factor here. Those alveolar walls are stretched and they're all just floppy. And so we can't get that gas to go through it like they need for oxygen use. So some medications that we use to treat these lower respiratory tract infections, beta agonists, which would be albuterol and salmeterol. This is going to relax that airway so that we can get the air going through those passages. Albuterol we use for quick relief. A lot of people have albuterol rescue inhalers for when they're starting to have an acute attack. Some people use this with nebulizers, especially when they're having respiratory illness. The salmeterol is used for maintenance therapy, so this would be something that you might take every day. Some of the side effects albuterol and salmeterol does cause your heart to beat a little bit faster, so it might have tachycardia, palpitations. They might get some tremors as well. Corticosteroids is another thing that we can give for respiratory disorders. Prednisone, methylprednisone. Remember, prednisone or any type of steroid is going to decrease inflammation. And that's what's going on here is we've got to decrease that inflammation so we can get air to go through there. It's going to decrease that swelling. We do worry about chronic use because we know also that steroids cause you to be immunosuppressed. So if we have somebody that's on prednisone for a respiratory infection, we know now they're also at increased risk for developing another infection. It can also cause their blood sugars to go up. It causes mood changes. Most commonly, the mood change you're going to see is they get really cranky. Some people feel really good while they're on it. And then the other thing that steroids can do is over a lengthy period of time, they can take away some of the calcium in your bones. And so that will lead to brittle bones. Now, I think we've talked about this before, but whenever we're getting off of the steroids, we have to taper that dose down, okay? So it may say take 2 pills every day, and then we'll go down to 1 pill in the morning, 1 pill at night, and then we might go down to 1 pill a day, half a pill a day, half a pill every other day. And so we have to slowly taper that down because our adrenal glands that sit on top of our kidneys, while we've been taking this steroid, they've went to sleep, and we have to go back and slowly wake them up. If we just stop taking steroids completely, we'll go into an adrenal crisis, and that's very, very severe. Methylxanthines, theophylline, and theophylline is a medication that we give a lot of our emphysema, COPD patients. It's going to relax that smooth muscle, and it also provides some anti-inflammatories. It does kind of increase their alertness and decrease their fatigue. Some things that they complain of is GI discomfort, headaches, dizziness. We do have to monitor their blood levels to make sure that they are in a therapeutic range. Leukotriene modifiers, Montelukast or Singulair, is a newer medication that's come out. It prevents those leukotriene receptors on the cells that keep the airways open, reduces inflammation, decreases the severity of some of the asthma manifestations. So what we're wanting it to do, reduce our inflammation, stop that tightening of our airways so we can breathe a little bit better, decrease the mucus production, and it helps to improve our airflow. Some of the things that we see with this is headaches, tiredness, influenza-like symptoms, coughs. Adverse effect would be angioedema. This is a medication that they need to take every day. It's a maintenance medication.